Hi, I'm Dr. Michael Reinhorn. I am a hernia specialist at Boston Hernia. I'm going to talk to you today about the recovery after ventral and umbilical hernia in that second half of the first month after surgery. So after 2 weeks, most people feel pretty good. We have lifted restrictions on activity. We tell you that in terms of activity, you can gradually increase your activity level. If your repair was done with mesh, generally at 2 weeks, there's 0 restrictions on activity, but we tell people to gradually increase that activity level. Just like any injury, you're not going to go back to full force immediately after that injury. And surgery is a type of injury. The body needs time to heal. In fact, the fascia that we close requires 6 weeks to get to its full strength, but at 2 weeks, it's strong enough that you can slowly increase that activity level to your tolerance. There's no absolute right or wrong other than if you're going to go to your peak weight at the gym on 2 weeks in 1 day, that was probably not the right thing to do, and your body might not tolerate that well. Going for long walks, starting to jog, if comfortable, is okay. The transition usually is over a 2-week period where people gradually increase their activity level up to that 4th week. Some people are still having a significant amount of pain at 2 weeks. As long as that pain is the same or slowly better than it was after initial surgery, it's still within the norm, though it is an exception to what we typically see. But having done this 6,000 times, there are some patients that just experience pain in a way that just lasts longer and requires more Tylenol, more time. But we look for a trend. We just don't want to see pain that wasn't there a week ago that's there now, that's getting worse. That could be a sign of a problem and should prompt a phone call. Generally, we do expect as you become more active that you'll have some pain with movement. So twisting motion, stretching motion will cause some tugging, pulling, and occasional sharp twinges of pain after surgery, and that's what's expected. And that's expected for the first few months after surgery, not just that first month after surgery. In terms of work, diet, routine daily activity or school, you should be back to normal or close to. And while the hernia may still be on your mind for the most part, there's going to be parts of the day that you really forget about having had that surgery. And certainly by the end of the month, we hope that the only reminder that you had surgery is your post-operative appointment, and that's when we see you after surgery.